Breathe out. Breathe out. Hi, Angelina.
Hi, how are you?
I'm okay. How are you?
I'm good, thank you.
Thanks for coming in. So, you're here because you have some back problems, back pain. I read in the file that it's been kind of chronic. So, go ahead and tell me, when did this start?
It started up about 3 or 4 weeks ago. I do gymnastics, so I am pretty active.
Okay.
And I've noticed that whenever I'm done with practice, my back is starting to hurt more and more.
Okay.
And it's starting to get progressively worse.
Okay. And where is it located, the pain?
Mostly like my lower back and then like near my shoulder blades.
Okay. For how long have you been practicing the gymnastics?
I've been in gymnastics for about 7 years.
7 years. And have you had any major injuries?
I tore my labrum in this shoulder, but that's about it.
Okay. And any recent falls that maybe you could associate the pain with?
Not that I know of.
Okay. So it sounds to me like we need to do more of a management type of treatment, which could require quite a few sessions that we do every week so that we adjust you and we realign your spine, your shoulders, and your hips, your hip bones. We want to make sure that they are in perfect alignment. That usually helps with muscle movement and with mobility to increase the spacing between the vertebrae. Do you have any problems with the way you walk? Any pain?
No, not that I can think of.
Okay. Any pain in your neck, headaches that won't go away?
Headaches occasionally. They're not often, but every once in a while when I'm working out a lot, I'll notice that a headache will come up and it won't really go away until I rest.
Okay, that makes sense. What I think is happening is that there is a constriction of blood vessels, so not enough oxygen is going to the brain, and usually that lack of oxygenation can cause, on top of like mental and blurriness and stuff like that, it can cause headaches. So it's something that can be fixed through chiropractic adjustment, and we can definitely help you today. I want to take a look at your back to see what we're dealing with.
Okay.
And then I want to see your gait, how you walk, to see if there's any imbalance in the hip bones and what we need to adjust.
Okay.
All right. Okay, Angelina, I'm going to have you take a few steps towards me. So just walk relaxed and now turn around. I know there's not a lot of space here, so go ahead and keep on walking. Good. And come back. Okay. I'm noticing a little bit of pronation on the left side. Go ahead and turn around for me. So let's take a look at your lower back. I'm gonna put your hair up. Okay, I'm going to palpate, starting with the sacral region. Just really feeling for any pulsations. Muscle movement. Okay, definitely on the right side, I'm feeling? Okay, do you feel that?
Yeah.
Okay. Okay. Looking at the imbalance at S1 and palpating the iliac joints. Okay, a little bit of pronation on the right side. Go ahead and bring your feet together for me. Okay, perfect. Any pain here?
No.
Okay, so I'm gonna have you lift your left leg kind of in a 90-degree angle with your shoulder, with your hips. Any pain when I'm pressing down here?
Very minor.
Okay, now go ahead and with your left heel, push it in the floor in front of you. Okay, and any pain here?
No, it just is a little uncomfortable.
Okay, come back to center. Now with your left arm, go ahead and touch the left side of your knee on the outside. So go ahead and stand up straight.
Okay.
I'm just gonna show you. Just gonna slide your arm like this, okay? Okay, go. Any pain here?
Yeah, it's super tight.
Okay. Come back to center. So we'll do the same thing now with your right knee. Go ahead and lift it up in a 90-degree angle. Any pain here on the left side?
No.
Right? Right side? Where I'm pressing right now? Okay, so go ahead and push down with your right heel in front of you. Okay. Any pain here? Okay. Go ahead and try to touch and bring your leg towards you and try to touch the right side. Any pain here?
Not pain, it's just a little tight.
Tight. Okay. Come back to center. Let's go ahead and take a look at your shoulder blades. Okay, so go ahead and try to relax your arm. Just gonna try to touch the middle of your back. Any pain when you're doing that? Just gonna press down in your palm. Let me know if this hurts. Does this hurt? Any pain here?
No.
Okay. Let's go ahead and do that on the right side. So relax. I'm just gonna guide you. Okay, a lot more flexibility on the right side. Any pain here? Okay, relax. All right, now with your left shoulder, so you mentioned that you're having pain in both shoulders. I'm just going to palpate as you're making and doing some movements.
Okay.
So we're looking for any dysplasia. Good. Now lower it down. Back to center. Perfect. Any pain here?
It's just a little tight.
Okay. Okay, now go ahead and move your arm above your head. Any pain here? Okay. Come back to center. Okay, go ahead and move your arm again, just in a 90-degree angle. I heard a little bit of cracking, so that's definitely something that we can improve. Okay. All right, now go ahead and put your arm above your head. Okay. Any pain here?
It's a little tight in my shoulders.
Okay. Come back to center. Let's go ahead and check your spine. Okay. Very little movement in the cervical spine, which could explain a difference in angles. Right shoulder is more elevated than left, and that just indicates there's a little bit more fluid buildup and inflammation on the right side. Okay. The chances of you having scoliosis or any abnormal curvatures are very small. We don't usually see that in gymnasts. Any pain here?
No.
Okay. Got a little bit of change in temperature. It is kind of warmer on the right side. Scapula angle is inwards. Okay. I'm gonna have you lay down and let's take a look at your legs and see if there is any adjustment that we need to do there first.
Okay.
Okay. Taking a look here at the length of your legs. Right leg is a little bit shorter than left. Okay. Just palpating here your knee capsule. We definitely don't want you to have any knee injuries. And sometimes when there's an imbalance, definitely can be triggering. Okay. Any pain here?
Mm-mm.
Okay. All right. What we can do today is to lengthen the legs a little bit. That will give some space in the hip area, and you're gonna feel a lot better even when you walk. So go ahead and take a deep breath in and breathe out. Good. Okay, just pressing that here. Go ahead and take another deep breath and breathe out. Okay, very good. So let's check your knees here. Go ahead and relax. Good. No popping sounds. Relax. Good. Okay. Just gonna slide my hand here under your ankle. Any ankle injuries?
Mm-mm.
Okay. Okay, a little bit of popping there. Any pain?
No.
Okay. This ankle is not very grounded. We're just gonna have to do a little bit of treatment here. I'm gonna apply an anti-inflammatory oil, okay?
Okay.
Starting with the dorsal part of your feet. Trying to stimulate the muscle so that it relaxes and gets very loose. And we're going to be able to do a good adjustment. Okay. Just applying some pressure here. Okay, using pressure points is very beneficial when you're trying to heal pain. And we're just activating certain points in the spine. That's going to help when we do the spine adjustment. Sometimes these points, if we're targeting the right muscle, then it can feel even a little bit tender. I'm going to apply cold therapy. I'm not feeling any nodules. Just applying that pressure therapy. You're gonna feel a little bit of cold. We're really just trying to dissolve the tissue that has been forming around the bone. Okay. Go ahead and take a look at your hip alignment here. Have you ever had your hips aligned before?
I have not.
Okay. You're not gonna feel any pain. It's just a little bit of pressure while we do it, but usually you're gonna hear like a cracking sound, and that's totally normal. Okay. So I'm gonna ask you to give yourself a hug, kind of like that. Perfect. Turn a little bit towards your left hip. Okay. Bend this knee up. All right. On the count of 3, go ahead and take a deep breath in. Okay. 1, 2, 3. Breathe out. Okay, perfect. So we'll do the same thing on the other side now. Go ahead and flip a little bit on the right hip. Good. Okay. Go ahead and take a deep breath in and exhale. Perfect. So let's go ahead and adjust your arms as well. Just going to find the pressure points here that we need to activate. Okay, go ahead and take a deep breath in and breathe out. Okay, perfect. Go ahead and relax. Going to gently press down here and let me know if it hurts. Trying to find the activator.
This one's a little sore.
Okay. So we're just gonna go ahead and increase some of that space so that more nutrients go into the capsula. It's gonna help with the pain, okay? Take a deep breath in and breathe out. Good. Perfect. Okay. Perfect. So let's go ahead and take a look at your neck. Just going to slide my fingers right under your neck, starting with cervical, just feeling for any tension, popping sounds. Tiny bit on the right side. Very tense as we're going towards the spine. Okay, before we do an adjustment, I really want to loosen up the fibers. Okay. It's very tight right here on both sides. No wonder you're getting headaches. Definitely having better circulation towards the head is going to help with that. Go ahead and relax your head, okay? I'm going to start by loosening up a little bit this muscle right here. So the sternocleidomastoid muscle really makes a huge connection between the head and shoulders. It's gonna help if we loosen up the ligaments around it. I'm going to apply a little bit of anti-inflammatory oil. Is it okay if I lower the strap?
Yeah.
Okay. Okay, you're gonna feel my knuckles. It's very easy for me to understand how deep it goes when I use knuckles. Definitely you want to go deep, but not too much to cause discomfort. It's gonna feel a little bit cold. Applying cold therapy usually activates vasodilation and it helps to increase circulation. Let's go on and take a look at the other side. Okay, right side is a little bit less tight. to apply cold therapy. Go ahead and relax your head. Relax. Good. Okay, definitely feels a lot better. Go ahead and take a deep breath in and breathe out. Good. One more time. Take a deep breath in and breathe out. Good. Okay, so go ahead and flip over. I'm going to take a look at your spine now. Just pressing down on the opposite sides. Just checking to see if there is any communication or swelling. Just doing one test here to see if there is any inflammation running from the cervical spine. Feeling a little bit of fluid build up around the vertebrae. Go ahead and try to lift your right leg up. Okay. Come back to center. And now left. Come back to center. Very little movement right here. We can definitely try to adjust T3 and T4. Also, there are points in the cervical area, neck, that if they feel kind of tense, that's kind of where we need to adjust. So right now I'm feeling a knot right here, and that is very close to S1. And this point right here corresponds to T6 and 7. Okay. This is gonna feel kind of tight. We're gonna do a little bit of skin pulling. Go ahead and take a deep breath in and fully exhale. One more time, take a deep breath in and fully exhale. Good. And now go ahead and lift your legs up in a 90-degree angle, just like this. Hold them. Take a deep breath in and exhale. Good. And relax your legs. Okay, you're gonna feel kind of like a popping sensation. This helps to adjust the spine. It increases flexibility. To apply anti-inflammatory oil. We're going to work on the pressure points. Let's use this one. We're using gentle cupping. Helps to stimulate blood flow. I'm going to do a scalp stimulation. This is a very gentle hair pulling. It helps to increase blood flow to the brain. Also decreases incidence of migraines and headaches. I'm gonna have you get dressed and I'll see you back in the next session.